Bird flu, also called avian influenza, is a serious concern. It is caused by influenza viruses. These viruses naturally live in wild birds. Ducks and geese are common carriers. The virus spreads through their droppings and saliva. It can contaminate water and soil. Domesticated birds like chickens and turkeys are also at risk. They can catch the virus from wild birds. Close contact and shared resources increase transmission. Bird flu can quickly spread through poultry farms. This can lead to significant economic losses for farmers. Symptoms of bird flu vary in severity. Some birds show no signs of illness. Others experience mild respiratory problems. In severe cases, bird flu is highly deadly. It can cause rapid death in entire flocks. Controlling the spread of bird flu is crucial. Farmers and veterinarians need to be vigilant. Early detection and rapid response are essential. This includes quarantining infected flocks and implementing strict biosecurity measures. Public awareness and education also play a vital role. There are many different strains of bird flu. Some are mild and cause few problems. Others are highly pathogenic and lead to severe illness. H5N1 is one such strain. It is a cause for global concern. H5N1 first emerged in 1996. It caused a large outbreak in geese in China. Since then, it has spread to many countries. H5N1 is highly contagious among birds. It can wipe out entire poultry populations. The virus can survive for long periods in the environment. This makes it difficult to control. Birds infected with H5N1 can shed the virus for days before showing symptoms. This silent spread makes it a challenge to contain outbreaks. The impact of H5N1 on bird populations has been devastating. Millions of birds have died from the virus. It has affected both wild and domestic bird species. The economic consequences for the poultry industry have been substantial. While bird flu primarily affects birds, it also poses a risk to humans. People can become infected through close contact with infected birds or their droppings. The virus can spread through the air in some cases. Though rare, human infections with bird flu viruses, particularly H5N1, can be severe. Symptoms in humans are similar to those of seasonal flu. They include fever, cough, sore throat, and muscle aches. In severe cases, bird flu can lead to pneumonia, respiratory failure, and even death. One reason for concern is the possibility of the virus mutating. Influenza viruses are known for their ability to change. If a bird flu virus were to acquire the ability to spread easily from person to person, it could potentially trigger a pandemic. Scientists closely monitor bird flu viruses for mutations. They are working to understand how these viruses evolve. Research into vaccines and antiviral medications is also ongoing. These efforts are crucial for pandemic preparedness. In recent years, there have been several notable outbreaks of H5N1 bird flu. These outbreaks have affected poultry farms and wild bird populations worldwide. In 2022, a large outbreak occurred in the United States. It led to the culling of millions of chickens and turkeys. These outbreaks highlight the continued threat of H5N1. They underscore the importance of surveillance and control measures. In 2023, there were a small number of confirmed human cases. The World Health Organization closely monitors these outbreaks. Preventing the spread of bird flu requires a multifaceted approach. Biosecurity measures on poultry farms are essential. These measures include restricting access to poultry houses, maintaining strict hygiene protocols, and controlling rodents and other pests that could carry the virus. Vaccination of poultry is another important tool. Vaccines can help to reduce the severity of outbreaks and prevent the virus from spreading to humans. However, the availability and effectiveness of vaccines vary depending on the specific strain of bird flu. Surveillance and early detection are crucial. Monitoring wild bird populations for signs of infection can help to identify outbreaks early on. Rapid reporting of suspected cases to veterinary authorities is essential for timely intervention. Public education plays a vital role in prevention. People need to be aware of the risks associated with bird flu. They should avoid contact with sick or dead birds. If contact is unavoidable, they should wear appropriate protective equipment, such as gloves and masks. Bird flu is a complex and constantly evolving threat. The emergence of new strains and the potential for human infection make it a global health concern. Staying informed about bird flu is crucial for protecting both human and animal health. Reliable sources of information include the World Health Organization, the Centers for Disease Control and Prevention, and local health authorities. These organizations provide up-to-date information on outbreaks, risks, and preventive measures. Following recommended health guidelines is essential. This includes practicing good hygiene, such as frequent hand washing and avoiding contact with sick birds. If you experience flu-like symptoms, especially after potential exposure to infected birds, seek medical attention immediately. By staying informed and taking appropriate precautions, we can help to mitigate the risks posed by bird flu. Remember, knowledge is power, and in the face of emerging infectious diseases, it is our best defense.